The present level of the art of upper extremity prosthetics does not permit the attainment of these goals by pure prosthetic function. Assistive foot function, some assistive devices, and minor modifications in clothing are necessary. She was first seen at 10 months of age and presented with instinctive foot skills. Initially, she was fitted with bilateral shoulder caps. After she had developed independent standing and walking, it was elected to fit her with unilateral, body-powered prostheses with which she developed prosthetic feeding skills. She subsequently was fitted with a programmed, externally powered feeding arm. This permitted a more acceptable feeding pattern and produced conservation of energy. Increasing age required more live elbow lift, so a powered elbow and powered terminal device were introduced. Finally, the most sophisticated powered elbow and powered terminal device currently available were introduced. This period of 12 years training, both for foot function and prosthetic function, must be kept in mind when you view the current results in a 13-year-old girl. Wendy's highly developed foot skills make many daily household tasks relatively easy. Without her prosthesis, if she is required to pick up something when unable to use her feet, she must do it with her mouth. To carry without her prosthesis, she must place the object in a position so that she can oppose her chin to her shoulder and thus grasp it. A padded hook situated at the appropriate height for the size of the individual facilitates removal and/or application of clothing. Cleansing after toiletry can be accomplished in a variety of manners. The one demonstrated here requires fully mobile lower extremities with well-developed foot function. When such is available, this is the most satisfactory mechanism. The problems of urinary toiletry are quite different in the male, and prosthetic assistance for urinary toiletry is very helpful. Modification of underclothing for facilitation of dressing is sometimes desirable. This patient by preference wears bikini-type panties. prosthesis is dressed before donning. Wendy seems to have a bilateral fitting. Actually, the left arm is the powered, functional one. The right arm is cosmetic and functions as a storage place for batteries. This buttoning sequence demonstrates the high degree of digital dexterity that can be developed in the feet. The scars at the metatarsophalangeal joints are the results of scraping her toes on the floor of a swimming pool. It is easier to dress the prosthesis prone and then turn it over to get into it. Notice how pick-up and carry are so smoothly done with the prosthesis. You will notice that in this sequence, she is right dominant. have noticed the scar in the region of the left knee. 1/3 of the patients with bilateral upper extremity amelia have inequality of leg length. Wendy was in this category, and the scars are the result of an epiphyseal arrest of the distal femoral epiphysis. The advantage of the prosthetic device for carrying is again demonstrated. Wendy opens the refrigerator door with her knee because, according to her, it is easier. Yet she uses the handle on the freezer compartment to pre-position her shoulder in humeral flexion to facilitate reaching into the refrigerator chamber. Wendy demonstrated her right-footed ability in personal hygiene. Here, she uses right and left interchangeably. Wendy's parents insist that she be responsible for preparing her own breakfast and performing other assigned daily household tasks. In this powered upper extremity device, there is a coordinated 4-bar linkage between the elbow and the wrist, so that with elbow flexion, there is wrist rotation that points the terminal device toward the mouth. It would appear that there has been a complete substitution, foot for hand pattern. Prosthetic writing for the shoulder disarticulation level is really torso manipulation of the prosthesis. Foot writing is toe manipulation of the writing instrument. Both of these are probably a kind of drawing of a central image. Both patterns of drawing are personalized for the individual. Notice the dexterous manner in which the pages are turned. The absolute necessity for assistive foot function in dress and undress is here demonstrated. Hip mobility is essential. It has been mentioned before that Wendy is equally dexterous with her right or left foot, but here it is clearly evident that she probably is left foot dominant. When questioned concerning how she maintained sitting balance and how she learned to play ping pong, she was unable to identify any specific sequence of events that led to this demonstrated competence. She simply wanted to play, tried it, and practiced. The tibio-talar and hind foot complex can apparently reproduce the variety of motions that we normally associate with forearm and wrist mobility. We do not know exactly what Wendy does to prevent striking her head on the floor of the pool. She wanted to swim, was given the opportunity, and has acquired the skills you observe. The mechanism is undoubtedly hyperextension of the entire spine. She can perform equally well on a 3-meter board. The use of her head and shoulder as an adaptive mechanism of stabilizing her trunk when climbing out of the pool is well demonstrated. Wendy's ability to alter her swimming pattern and simulate butterfly, breaststroke, side stroke, and backstroke is remarkable. This sequence demonstrates the high level of skill and grace that can be developed in a well-motivated patient with this degree of disability. Wendy is undoubtedly a superior performer, but not unique. In our patients with bilateral upper amalia who have legs of adequate length and full mobility, many of them have developed functional and recreational skills that are similarly outstanding, but related to their personal desires and motivations. One might wonder whether prosthetic fitting and intensive occupational therapy training are necessary. It is important to remember that this patient has had 12 years of continuing inpatient and outpatient prosthetic and training service. She has had the opportunity to try a variety of rehabilitation procedures or techniques. On the basis of her personality and discriminatory judgment, she has found a compromise that permits this level of accomplishment.